All right, we are live.
Okay, well, thank you, everybody, for joining us. And also thank you to our esteemed panel, who will be introduced very shortly. In the meantime, I'd like to introduce City of Norwalk Communications Manager Josh Morgan, who will do some housekeeping, introduce the panel, and get us started.
Thank you, Mayor Rilling, and good evening, Norwalk. Good evening, everybody. Tonight's town hall, COVID-19 vaccine education, communication, and outreach is being presented in English. We do have Spanish language and Haitian Creole interpretation available for those watching on Zoom. Simply select the interpretation button on the bottom of your screen and select a different language. We also have American Sign Language interpretation, which will be shown on the screen the entire time tonight. For residents and members of the public who are watching on Zoom, you can enter questions into the question and answer box on your Zoom screen. Simply just select the bubble icon that says Q&A on the bottom of your screen. It will open a dialog box and you can type in your question. We'll keep an eye on the Q&A throughout tonight's town hall, which should last about an hour, and we'll address the questions as we get them. So no need to wait to the end. You can enter your questions at any time. Joining us tonight, obviously, we have Mayor Harry Rilling. We have Ken Waller, who is the Chief Executive Officer of the Norwalk Community Health Center. Amy Taylor, who is the Vice President of the Western Region for Community Health Center, Inc. And Deanna Diamore, the Health Director for the Norwalk Health Department. So this is a panel of community partners who have been working hand in hand with the city of Norwalk throughout the pandemic and moving from testing to vaccination and continuing our outreach to the community. So look forward to a robust conversation tonight. And with that, I'll turn it back over to you, Mayor.
Thank you, Josh. And again, thank you to the panel for joining us this evening. We have a lot of things to discuss. And Josh and I will be kind of putting things out there for discussion, but we also want you as panelists to talk about what's happening in your individual organizations, what your plans are, what you're noticing, the trends, things that people need to know. From our perspective, we continue to put out our daily briefing, which updates the number of cases that we have. Unfortunately, with the number of cases today, we've just reached a little over 11,000 of our residents have contracted the virus. We're continuing to do our vaccine clinics, and I'll let Deanna speak a little bit more about that. We're doing testing on a daily basis still at Veterans Park and at Brian McMahon High School on certain days. So you can find that information on our daily briefing. We also continue on Wednesday mornings to do our food distribution at Calf Pasture Beach, which will be eventually moving over to Veterans Park as the season progresses. And it just shows that there still is a lot of food insecurity in the city. We want to stress tonight that the vaccine is still with us. And although we're vaccinating more people, we're seeing some trends that are very unsettling, and we want to discuss those tonight. So the first thing I'd like to do before I introduce Ken and Amy, I want to ask Deanna to give us an update. As I'm sure you all heard, there's been a pause for the J&J, the Johnson & Johnson vaccine, because of the situation around the country, where I guess 7 people have developed blood clots. Now, in all fairness, that's out of 7 million vaccines given. So it's a very small number, but it's still very troubling. And to err on the side of caution, I followed the advice of the CDC and the DPH, and I paused the vaccine here in Norwalk, only to J&J. We're still going to be doing Moderna and Pfizer. So Deanna, if you could update us on that.
Sure. Good evening, Mayor. You did a great job already giving the briefing of that. So just to add, the state reports that around 100,000 residents of Connecticut received the J&J shot, and there have been no severe adverse effects within Connecticut. But, you know, the CDC and the FDA, out of an abundance of caution, wanted to pause use of the vaccine to give them time to really study to figure this out. So the advisory committee on immunization practices met today to discuss and look over the data and the situation. They've decided that they really need more time to assess the data and the risks. And so they're not going to have a formal recommendation yet until they meet again in a week or about 10 days. So more to come on that. But for now, they're pausing administration just to determine what's going on and to determine if it is a link between the vaccine and these effects. So more to come on that. In the meantime, providers are going to be utilizing Moderna and Pfizer like they've been doing. The state is working on making sure people still have their appointments and to make sure we're continuing the administration of the vaccine so that we can get more shots into arms. Thank you, Mayor.
Thank you, Deanna. I keep hitting the button. And thank you, Deanna. Thank you for that update. Now, if we would, I'll turn it over to Ken and ask him to talk a little bit about what he's seeing and so forth, and then we'll move on to Emily, and then we'll start adding some questions in here. And so, Ken.
Yeah, thank you, Mayor. So just to kind of amplify what Deanna just kind of spoke about, I mean, we have also kind of paused on the J&J vaccine due to federal guidance. Right now, we are still providing the Moderna vaccine to the public as well as to our patients. And again, I agree with the mayor in terms of the number of people who have been affected by J&J. I still believe that the vaccine will come through and we will be able to continue to move on with that because it's so important. But here at Norwalk Community Health Center, we continue to move forward with vaccinating our patients as well as opening up our vaccine clinic to the public. In addition to that, we're working very closely with some community stakeholders to identify opportunities where we can bring the vaccine into the community. And we had a great discussion today, and we agree that we won't be using the J&J vaccine when we do community vaccine distribution, but we will be using Moderna. So we continue to move forward with our ongoing strategies to ensure that people have access to the vaccine.
Thank you, Ken. Now we can move on. If Amy would give us an update and let us know what's happening in your neck of the woods.
Absolutely. Thank you, Mayor. Hi, everyone. My name is Amy Taylor, and I'm a Regional Vice President for the Community Health Center. As you know, we've been part of the fabric of Norwalk in terms of healthcare provision for about 10 and a half, 11 years now. And throughout the pandemic, we've been offering lots of testing services, both at Veterans Park and more recently over at Norwalk Community College. And both of those locations continue to be open for testing. It's still just as important as ever, as I'm sure Deanna would share with us, now more than, or as it was before, to get tested for COVID if you have any symptoms or signs or have had an exposure. We are also providing vaccines to our community. The Community Health Center across the state, as of yesterday, hit the 250,000 vaccines administered mark. And so we were really happy about that. And data as it relates specifically to Norwalk, we have administered just over 10,000 vaccines to Norwalk residents. Most of those have been administered at our Lord and Taylor mass vaccination location in Stamford, where we've delivered 61,000 vaccines. And 1/6 of those have been for our friends and neighbors in Norwalk. And so we're really happy about that. In addition to that, we have done some mobile vaccination clinics at some places that really benefited from us bringing the vaccine to them. And we've done about just over 300 vaccines in those types of settings and are eager to continue that work and have some additional clinics scheduled for this week and next week. We have always used the Moderna and Pfizer vaccine for our community vaccination clinics. At our Lord and Taylor site, it's a combination of Moderna and Pfizer. And when we go out into the community, it is also a combination of Moderna and Pfizer. We've never used the Janssen or J&J vaccine simply because we have had sufficient supply of the Pfizer and the Moderna vaccine to allow us to do that. And just because of the comfort and the reception in the communities for both the Moderna and Pfizer vaccine, we decided to really stick to using those. The other exciting thing that I can share is last Sunday, we hosted a special event at our Lord and Taylor site for Norwalk high school students and their families. And we were able to vaccinate just around 950 people. And then we have a second day scheduled for Norwalk high school students and their families on April 24th. And so far we have about 943 people registered, but there's still many, many slots open. So if you're struggling with getting an appointment through the VAL line or the VAMS line, and you have a student who is in the Norwalk school system and are interested in getting a vaccine on the 24th with your student, please feel free to sign up for that. We're encouraging students to decorate their cars and bring a banner, do something fun to raise spirit, high school spirit. We know that the students have been so resilient over this past year, but we also know students are students and they like to do things like the prom and graduation and senior activities. And so having these specific clinics dedicated to high school students who are 16 and up, we really hope will help the schools, one, be a healthier, safer environment for teachers and students, but also allow our students to get back to a little bit more of what is normal for students and enjoy the end of their senior year and hopefully get us that much closer to ending this pandemic. So that's where we are. And we just appreciate, the Health Center really appreciates the partnership that we've had with the city over the past 12 months.
Thank you, Amy. And we truly appreciate the partnership we have with you. It's critically important that we vaccinate as many of our young people, our high school students, as we possibly can. I know that last year and a lot of this year, especially the seniors, they've been robbed of their high school experience or their last year experience. And the good news is that so far the schools have been cleared under safe circumstances to hold proms and graduation ceremonies. So we're hoping that that continues. It's also a good segue to Deanna. Deanna, could you talk a little bit about the trends we're seeing? Because we are starting to see a troubling trend where a lot of the younger people are starting to contract the virus.
Sure, thank you, Mayor. So I'm just refreshing the data right now. So within the past 2-week time period, where the latest data is showing that 28% of our cases in Norwalk have been 19 and younger, between the ages of 0 and 19. And so if you compare that to the entire pandemic, we'll see that the cases are trending much younger right now. The entire pandemic, it's been about 18% that had been, if you look at from the beginning to now, from 0 to 19. So we're definitely seeing trends in the younger ages. And so, as the vaccine has become more available to adults, we're seeing that it's working. We're seeing lower trends among the older populations, but we are seeing increased transmission in those younger age groups right now. So we just continue to remind everyone that mask wearing is very important, keeping distance, limiting, contact is important. And just to be safe, to remember those measures that have been kept us safe, and to continue to not let our guard down as we see this transmission. We know there are different variants out there right now as well that are more transmissible. So we are seeing some of those as the mayor described, some of those cases in the younger age groups right now.
One of the, thank you, Deanna. One of the things that we find critically important is accessibility. And if the panel could address a couple of the issues about the plans for bringing the vaccine out into the public. That's critically important because a lot of people don't have transportation. We're also looking at different hours that we can conduct the clinics because people who work during the day can't necessarily get to a clinic. So if we could address that issue, maybe go through the panel. Deanna, you want to start that off?
Sure, Mayor, I'll start. So we have offered some Saturday clinics to be able to reach people on weekends, and we are also offering like late afternoon, evening hours. So I'm sure many people are aware that we have this partnership with the Bow Tie Cinemas, and so we were there today. Our clinic hours were 2 to 7 p.m. We were there the week before, till 7 p.m. So we're trying to stretch out into the evening to allow, especially for the younger populations who are working, to be able to access the vaccine. Being at the Bow Tie is a great location in South Norwalk. It's accessible to a lot of people living in the community. It's got transportation. It's close even to the train. So there's a lot of benefits to being in that location. We're also working with the state to bring the Griffin mobile vaccine units to Norwalk. So they started in different areas of the state, and we're really excited. We're anticipating bringing those in partnership with the state and Griffin Hospital, those mobile units to Norwalk next week. So we're really excited about that. We'll be announcing more to come the next day or two about location and what that means. But the exciting thing about that is that it'll be walk up. So it'll allow people just walk up and to get vaccinated, and they'll be here for over several days. So again, as Amy and Ken described too, they're doing some of that work as well. So we're always looking to expand that. And then also partnering with the state to bring the FEMA mobile unit as well in May for 2 days in Norwalk. It'll be a combination of walk up and appointments.
Ken?
Just to kind of continue on with what Deanna is saying, we're working very closely with a lot of the community-based organizations in town. I mean, we are in the preliminary stages of really getting our medical mobile unit out into the community and going where people can't get out to get access to the vaccine. So that's very important for us here at Norwalk. And so we're in the process of developing the necessary relationships in order to do that, because we know that there are people who are homebound or who cannot come out the house. And so we want to be in position to be able to provide them with that vaccine. So that's really critically important to our next steps going forward as it relates to vaccine distribution.
And I would just offer, if there, obviously the health department has done just an incredible job under Deanna's leadership getting the vaccine out. I love the idea of a movie theater, Deanna, how incredibly creative and wonderful that the movie theater allowed you to partner in that way. It's great. We've done some clinics in churches, and so in other kind of unique spaces, if there's an interest in the community, we're always taking requests and responding to those, doing weekend clinics. So if anybody has a place that they would like us to go in partnership with the health department or any other group, we're here to serve. So happy to take any inquiries for that.
And Mayor, we have you on mute, but I just wanted to hop in really quick, just so we do have some attendees on, and just to remind folks, if you want to ask a question of the panel, to please use the Q&A function on the bottom of your screen. We'll keep an eye out on questions that are coming in, and we'll try to address those throughout the remainder of tonight's town hall. And before going back to you, Mayor, just also want to give a special thanks to Reverend Wesley Clark and the Norwalk IMF, the Interdenominational Ministers Fellowship, who have been really great partners with the City of Norwalk and the Norwalk Health Department. And under your leadership, Mayor, and Deanna's leadership, being able to partner with our faith-based groups to do these clinics, as Amy described, in churches, which folks recognize they know it's a safe place, they know it's a welcome place, and they're seeing a lot of their friends and neighbors. So that's been a really concerted effort and to reach our community. So I just want to give special thanks to the IMF as well.
Thank you, Josh. That's critically important. I think as we go through this, and now we've been through this actually longer than a year. I don't think anybody anticipated it would be that long, but early on in the city of Norwalk, we formed the necessary partnerships to start being able to, number one, do the testing. That was critically important. And we knew that once the vaccine was developed, that the vaccine administration was going to also perhaps be even more challenging, and it turned out to be the case. So, Josh, do you have any questions for the panel, or do we have any questions on the Q&A?
We have a question in the Q&A, which I'll direct to Amy, since she had mentioned it earlier, the partnership with Norwalk Public Schools and the number of students who were vaccinated. So, Amy, we have a question about which vaccines are available for students, and if you want to sort of talk about the age and what's going on, that would be super helpful.
Sure, happy to. So Pfizer is approved under the emergency authorization for people who are 16 and up. Moderna is only authorized for people who are 18 and up. And so our mass vaccination sites are using Pfizer for these clinics. And so what happens in the registration process, we partnered with the school system and the health department on this initiative to get the Norwalk students vaccinated up at our Lord and Taylor vaccination site. We have a simple registration link where if you are 18, you are considered an adult and can consent for yourself. But if you enter your age and you are under 18, then your parent must consent for you. And they attest and sign electronically in that registration form. And then they select the time that they would like to receive their vaccine, whether it was last Sunday or coming up on the 24th. And then when they hit submit, it generates an email to them, and that email confirms the time of their appointment, the location, which is obviously up at the vaccination site in Stamford. And it also includes the pre-vaccination questions that we are required to ask. And it's really important that those questions get sent to the parent and the student, the 16, 17, 18-year-old, because some of the questions are things that maybe a student wouldn't know just on their own. And some of the language in those questions that are required to be asked of people might not be something that a student would know off the top of their head. And so when the parent is consenting for their 16 or 17-year-old, they are also consenting to review the questions with their student before they go to get vaccinated. And in that confirmation email are all of the questions, so the parent and student can review them together. And then the student, when they go to get vaccinated, whether it's on their own or with their parent, they will be prepared to answer those questions on the day of vaccination. We are not asking them to answer those questions beforehand, because the questions have to be answered on the day of vaccination, but they can be prepared in advance. And so, so to answer your question directly, Josh, for these students, we are, and for most of our first doses, we are providing people with the Pfizer vaccine. We have Moderna. We are finishing up our second dose Moderna patients. And then there were some patients who had scheduled with Moderna through the VAL line and had received their second dose appointment 4 weeks later. And so we didn't want to disrupt that cycle. So those people are still getting their first dose Moderna. And that's it, but happy to answer any other questions about the process, if there are any.
That's great. And I'm glad the way you made it so much fun. The kids have been, pretty much isolated and distanced from their friends, and to be able to get out together and decorate their cars, it's almost like a homecoming football game. I think that's really great that you're doing that.
Yeah, I don't know, Mayor, did you see the video of your students when they were up there? They were just absolutely brilliant, absolutely brilliant. They were on Channel 12 and great spokespeople for the vaccine. One was a student who wants to become a nurse, and I told the health center, let's snag her. let's bring her in right when she finishes her schooling.
Put her to work now.
That's right.
But it's really great to see that, and the kids having so much fun, and it's really a tribute the way you did that. So I also know that there's some concerns in the community about the variants and the information that may be available as to the efficacy of the vaccines in relation to the new variants. And maybe when you address that, you could also touch on, because I believe some people think that the vaccine actually contains the coronavirus, which it does not. So maybe you can touch on that a little bit.
Well, I'll try it, Mayor. I'm not a scientist, but I'll try. I know that the variants are out there, and there's been some study and some thoughts around the vaccine reducing its efficacy depending on the variant. And that's as far as I can go. I mean, in terms of what's out there, I don't know if Amy could add on to that, but I do understand that there is some reduction in the efficacy based on the different variants.
Well, and I think Deanna is probably our local expert, but I will just say that it's really important for people to get vaccinated, because if you get vaccinated, it reduces the likelihood that the virus can spread and also replicate and change as it is doing. And so everybody is saying the best way to avoid these variants from continuing to merge is to get vaccinated and stop the spread. And that's through wearing masks, hand hygiene, social distancing, all the things that we've been talking about for the last year. In addition, we now have one of the most powerful weapons in our own defense, which is the vaccine. So Deanna, from a public health perspective, epidemiological perspective, is there any other science you would like to reference in that?
Sure. So I just want to add, the UK variant, the B117, that's the one that's the most predominant one in the United States right now. This week they did announce that all three of the vaccines that have been approved to be used in the United States have shown there's strong evidence that it is a good protection against that variant. So that's reassuring news, I know, to hear that. So like Amy said, and Ken was saying, encourage people to still be vaccinated while also following all those other health precautions and measures.
Okay, well, thank you on that. I know, Josh, we have another question you want to.
Yeah, we have another question in the chat, and I kind of want to build on this question as well. So, there's been over 2 million shots administered across the state, and Amy's referencing her numbers, and 10,000 Norwalk residents at the Lord and Taylor site in Stamford. So before we get to Rob's question in the chat, and I'm just sort of wondering, because our panel, they're also doing other things besides just testing and vaccinating. They're seeing patients for a host of different reasons. So I guess I would say if someone was coming to get vaccinated, you're not necessarily seeing any vaccine hesitancy, but are you hearing anything from your patients about concerned about getting vaccine or having trouble finding an appointment? Is the demand still outpacing supply? Because Rob is asking about upcoming vaccine appointments. So I would love to hear what the panel has to say about that. And then I can address Rob's question and our audience questions about ways to get notifications about upcoming clinics. So Ken, you want to start?
Sure. I mean, we are available to take on new patients and the general public to get to receive the vaccine. So we're not seeing any challenges with supply at this point. Obviously, we paused on the J&J, but we are here and we do have supply. and we're not seeing any challenges with getting patients in to get access to the vaccine. So here at Norwalk Community Health Center, we are available, and we're not seeing any adverse trends as it relates to supply and demand. I think there's probably there's a need for more demand, I think, but we are going to be encouraging that through service promotion.
And I would say that, of course, like you mentioned, Josh, if somebody is coming to an event or a vaccination site, they've likely overcome that hesitancy. But I would say it's also, particularly when we do these events in the churches, and I've done registration. I unfortunately don't have the superpower of being able to provide a vaccination to somebody, but I can register and I can scribe and I can do logistics. But and I've seen people, even while they're sitting there at the registration table, still hesitant and really needing that nurturing, kind of compassionate understanding around that hesitancy, and then having that conversation with the vaccinator who can really speak to their concern and helping them get over that fear, because that fear is real for some people. Obviously, there are many people in the community who are rushing to get vaccinated, but the people that we are truly embracing in all of this are those that, for whatever reason, because of all of the misinformation that we hear out there, or just general fear around vaccines, we want to talk to those people. We want to have a conversation. We're not in the business of forcing people to do anything. We want to have a conversation. We want to help people move from no way to maybe, and then hopefully at some point getting the vaccine. And I know that the health department, the Norwalk Community Health Center, the Day Street Community Health Center, we're all here to talk about it and really help our communities overcome this. I always say to people that, yes, the fear around getting the vaccine is very real, but also the reality of people in the hospitals dying from COVID is also very real. And I'm more afraid of that than I am of getting a vaccine. So, we're here to talk, and we're also talk to your church leaders, your faith leaders, your people you respect in the community, get the facts, learn the science, and really think about the value of this vaccine and how it can help us get back to normal and stop people from dying, because that's the reality of what we're living in this pandemic. So we do see hesitancy. To answer the question specifically, Josh, we do see it, and we embrace it. We try to help people move beyond it. We do not have any issues right now with supply. Of course, the J&J, we hadn't really been using that for any of our mass vaccination sites or any of our community-based vaccination clinics. Whether it's in a homeless shelter or a senior congregate, we had always been using Pfizer and Moderna, so no impact on us in that regard. But we know that there will be a time, and it will likely be in a couple of months, where those targeted outreach clinics in the community will be the way to help the remaining people who remain unvaccinated get vaccinated. The large numbers of people coming to mass vaccination at a certain point in the future will abate, but people like Deanna and Ken and I will need to continue to bring vaccinations out there so that those people who struggle with either the VAL line or the VAMS registration process or whatever other barrier, don't have any barrier, but can say, yep, today I'm ready for it. And look, there's a vaccine in my courtyard waiting for me to get vaccinated right where I am. And I think that's the approach that community health centers in general take to delivering care, care without barriers, care without any obstacles around insurance or access to services.
Deanna, you want to follow up on that?
Yeah, so just to build on what Amy and Ken have been saying, so I too have been worked at clinics. I've done registration. I can't vaccinate, but I've been at clinics, and I have seen like the whole range of some people are just can't wait. They're so excited to have an appointment, and we do see some people that are a little nervous, a little hesitant. So we always try to create an environment where very welcoming, very customer service oriented. Want to thank my volunteers, the emergency response team. They're like, I mean, they give people like the red carpet treatment. I think they're like so calm and nice and courteous to everybody. So we really try to create that environment for people, just as Amy described. In terms of appointments and availability, we tend to wait towards the end of the week to post our clinics and the appointments, because we wait to know exactly how much vaccine that we're going to get, because we don't have as a large operation like the community health centers and the hospitals do. So we will be having another clinic next week. We will be, Josh can tell you about our notification, how we let people know about our upcoming appointments. It's been a great, having the city helping us with all that notification has been super helpful. I do know that a lot of providers open up appointments throughout the week. They'll post new appointments. There's a lot of ways to find availability, whether it's through the vaccine assistance line, whether it's directly with the provider themselves, with the pharmacies and retailers, through the VAM system. So they do open throughout the week. And we have seen high demand for the vaccine, but we do know that there are some places that are starting to be more availability. And Josh, I don't know if you want to talk now about the way we've been notifying people of our clinics.
Yeah, I just want to direct folks to norwalkt.org/vaccine. That's the city website that's going to have all the latest information, ways to sign up on a vaccine wait list, ways to sign up for notifications. So what we have seen is that, and understand that not everyone has Facebook or Twitter. Not everyone is constantly refreshing VAMs trying to find an appointment. The state's done a really good job recognizing that not everyone has internet access, so they have the vaccine assistance line trying to get people scheduled. But what we've actually seen is clinics that the Norwalk Health Department is running, appointments filling up in 30, 40 minutes, hundreds of appointments, because there are these social media groups that share information out because there is a high demand for vaccine. So we do have a notification system on place on the website where residents can sign up. And for clinics hosted by the Norwalk Health Department, we will push out an email and a text message saying that there's registration and appointments available. So that is concurrent with information that we're sharing on social media and sharing with community partners. So it's just another avenue for folks to get a notification. The text message or the email will have a link directly to the website to make an appointment. Mayor Rilling had said it would make these appointments easy, let's make them accessible. So under that vision, Deanna and her team have created a online registration form that's outside of the Vaccine Administration Management System, VAMS. It literally takes 5 seconds to sign up for an appointment, and it's super easy. The staff and the volunteers handle a lot of the back end work that's usually front loaded on people who are trying to get the vaccine. So norwalkt.org/vaccine will have all of that information, and it's always going to be up to date because as Amy had said earlier, we have to get the facts and make sure you have the right information. There's a lot of stuff circulating online and on different groups and different publications. So norwalkt.org/vaccine. And Rob, I hope that answered your question. There will be vaccine appointments coming up. So thank you so much.
Thank you, Josh. A couple of things. Throughout this pandemic, we would hear something, and then later on, we would hear something contrary to that, because we're learning something new every day. I tell people that we're flying the plane as we're trying to build it. There's no manual on how to handle this, but I do want to commend all the healthcare professionals, all the volunteers for the work they're doing. I've visited a couple of our vaccine clinics, one at Brian McMahon High School, or two at Brian McMahon High School, one down at the theater. And, you know, it's true. The volunteers are so reassuring. They give you the red carpet treatment. They understand that you're going to be a little bit nervous. They understand that this is all brand new. It's all brand new to all of us. But you know, the ones down at the theater and at Brian McMahon High School, people were in and out in about 30 minutes, and that's about 15 minutes waiting to make sure that there was no adverse reaction. So I do want to say that it's really a credit to the way that the organizational structure of these vaccine clinics has been handled. The other thing, and I know that people have heard this, and maybe our panel can just reassure or touch on it. You know, after you get the second vaccine, then what? How long before you're fully vaccinated? And then are you able to just go out and ignore those safety protocols?
I would say that's not true, Mayor. I mean, I believe it's about 10 to 14 days before you become fully vaccinated after your second shot. And I think we still need to continue as a society to wear our masks and practice social distancing, as well as wash our hands on a consistent basis. So that's my response to that.
Totally, I agree. What about after the first vaccine? You get one vaccine and you're waiting Pfizer for 3 weeks or Moderna for 4. What's in between, and how much protection do you have at that point?
I believe with the Moderna, it's about 66% after 10 days. And then I think with the Moderna, I think it's 28 days before your second shot, and then you're considered fully vaccinated. We're not using the Pfizer here at Norwalk Community Health Center, so I can't give you any insight on that. So it's about 14 days after your second Moderna shot, you become fully vaccinated. But again, continue to practice social distancing and mask wearing.
Amy or Deanna?
So fully vaccinated 2 weeks after you've had your second dose. So absolutely, you need to, as Ken was saying, you need to be following all those precautions. And then even if you are fully vaccinated, when you're out in public, you should be still wearing your mask. You should be still following all those safety protocols. There are some, the CDC provided some guidance related for those who have been fully vaccinated. So one of the benefits of being fully vaccinated is if you have been a close contact of somebody who's tested positive, if you're fully vaccinated, you don't need to quarantine unless you develop symptoms. Also, if you've been fully vaccinated and you want to have a small gathering or be with other people that have been fully vaccinated, you don't have to be, wearing masks. So if it's like a, small with other people that have been fully vaccinated. So while you're out in public, you should still be following all of the guidelines. You should still be careful, but there are benefits to being vaccinated. Anything to add, Amy?
I think you covered it. Just, Pfizer 21, Moderna 28, and then plus 2 weeks is the formula that is magical. So keep that in mind. And then the social distancing.
Josh, I think we have another question.
We do, Mayor, and I'm guessing this is in reference to something that Deanna had mentioned earlier about the FEMA clinic and maybe some things with Griffin Health that we have planned in Norwalk. So curious about how walk-ups are going to be handled, or people taking appointments. Nancy seems to be concerned about having crowds, so we're still planning those. But Deanna, I don't know if you want to touch on some of what we're thinking and hoping to accomplish, and sort of what kind of vaccines we're going to be able to help get into the community.
Sure. So we're anticipating that the state will be able to have like the National Guard and others to assist us with some of that crowd control. We're also learning from others that have been doing the walk-up clinics. Like in Hartford, they've been doing them. They've been handing out numbers to people who are there, depending on how much vaccine is there. if more people are there that then have vaccine, able to connect them to another appointment, or being able to connect them to say, hey, we're going to be back here tomorrow, you're first for tomorrow. So there are some tips and strategies that we've been learning from others that have been doing this. And Amy, I know you've done some walk-ups. Is that correct? I don't know if you want to add anything.
Yeah, we have. We've done quite a few walk-ups. The majority is through registration, but we've done a good dozen where we don't take any registration. We simply go. We've informed people that we are coming. We also use some support from community health workers to go knocking door to door saying, come on down, here's your chance, or, through word of mouth, come on out. And it goes well. There are obviously pros and cons to both sides of it. We hand out cards with numbers on them and say, if you have card 1 through 10, it's approximately this time. If it's 11 through 20, please come back around this time. I think sometimes that approach can cause a little bit more waiting for people. And so that can be a little bit more frustrating, but we try to be very open and transparent beforehand, saying, this is a no registration event. And so there might be some waiting time. Obviously, it works better when the weather is nicer because you can't have large numbers of people gathered inside a building. Usually people have to wait outside. And so if it's raining or cold, then that can really dampens people's pleasure in waiting for the time that they have to. So, but we recognize that some people just aren't going to register. Some people will make a decision the same day. And so having a wide variety of approaches and getting vaccine out there is really important, I think. And I think as we progress through this, we'll see more and more of those non-registration events popping up to really address the people in the community who might be making that decision same day.
Right. We are running towards the end. I see another question popping up, Josh. Okay, that's a thank you. Thank you for answering. Will this lead to vaccine being wasted if people don't make appointments? I think we need to address that because that's a critical question. We don't waste vaccines because once you pierce the vial, you have to dispose of it if you don't get it in an arm. So maybe the panel can answer that question.
Yeah. So I'll just jump in for our approach. We absolutely don't waste vaccines. We staff will stay late to call people to make sure they get somebody to come to take the vaccine. It's a good opportunity to talk about Norwalk's waitlist. So Josh, I don't know if you want to go in more detail about that, but we call people off of the waitlist. There have been situations where, and this is why we asked Josh and IT to clear it every week now, calling 60 people to get maybe 4 to come. Like staff and volunteers, they won't give up. They'll get that person to come in. Josh, do you want to mention how to sign up for the wait list?
Yeah, I'll just jump in real quick for Amy and maybe talk about their approach, but norwalkt.org/waitlist. It's just a simple form. Enter your email and phone number and your name. And like Deanna said, if they've pierced a vial and they have 1, 2, 3, 4 doses left, they're not going to waste it. They're going to call through the wait list. Just want to stress that this is it's random, so they can download the data any day of the clinic, randomly sort the sheet and call through. So it's not first come, first serve. But to Deanna's point, when we had first created the wait list, there was close to 5,000 residents who had signed up on it. And the good news is that, so many of those initial people who had signed up have gotten vaccinated. The unfortunate news is after an 8-hour clinic, our volunteers are staying late and they're calling 60, 70 people to get one. But that's just a real testament to the dedication of the staff and the volunteers not to waste any vaccine. So we are clearing that list every Monday just to make sure that it has a fresh list of people. But again, I don't want residents who had signed up and haven't gotten a call yet to feel discouraged, because it is sorted randomly every time there's a clinic. So it's not first come, first serve. So no need to rush to sign up at 10 a.m. on Monday. But please, if you haven't been vaccinated, you can sign yourself up. You can sign your parents or your friends up. norwalkct.org/waitlist. And thank you for the question, Nancy. But Amy and Ken, I don't know if you want to address that before we turn it back to the mayor to close us up tonight.
No, that's right. I think that's considered a best practice. I mean, we're not wasting vaccines. We also have a wait list, as Deanna just talked about. And so we utilize that wait list as an opportunity to ensure that we're not wasting vaccines. And so we reach out as much as we can to identify people who are interested in having the vaccine. So that's right. No vaccines are to be wasted.
Yeah, same thing. Never wasted a dose. And we've had many late nights where, you vaccinate 1,800 people in a day, and then it takes 3 hours to vaccinate those remaining 6 syringes that you had to draw because registered people were there, and you had to puncture that vial. And having both Moderna and Pfizer open, Moderna usually gets 10 doses, Pfizer usually 6. And so when you puncture both of them, then you have extra doses often that you need to get into people's arms. And we do it. There's never been a day that it's been wasted.
Okay, we're about out of time, but we have 7 minutes left. I want to ask the panel, the single most important thing that you feel we should have talked about tonight, or that you wanted to get out in your message to the city of Norwalk, to the surrounding areas, the single most important thing that you wish we would have asked, or that you would like an opportunity to talk about.
Yeah, what I would want to say, Mayor, is that everyone should get the vaccine. It's critically important, and that we at Norwalk want to be very helpful in making sure that folks have access to the vaccine. So if you're in need of a vaccine, please reach out to our health center, and we will facilitate an opportunity for you to get the vaccine.
Thank you. Amy?
Yeah, just I think the incredible opportunity that the pandemic has presented to everybody to collaborate, to support each other. I think the city of Norwalk has done just a remarkable job in managing through this. Of course, we've lost so many of our fellow Norwalk residents, and my heart goes out to everybody who has lost somebody in this pandemic, or who has the long-term side effects from the virus. I think the other thing that I would just mention is that if you don't have a primary care home, a medical home, and you didn't establish care during the pandemic, please do so now, because we know that people who suffered the most were people who had chronic disease underlying their health status. And so when they got sick, they had a much more difficult time fighting off the infection. And so please do establish care. Ongoing primary care is so important to overall health. And so whether it's through the Community Health Center at Day Street, or the Nora Community Health Center on Connecticut Avenue, or through any of the private practices that are across the city, please establish care. Manage your chronic diseases, take care of your eating and your exercise, take care of your mental health, but really take care of yourself so that we overcome this pandemic and can be a healthier community for it.
Thank you, Amy. That was really good as well. Deanna?
Well, I can't top those statements, both of them. Of course, get your vaccine and all the great things that Amy said. We're here. My staff have been working tirelessly throughout this pandemic. Our volunteers have been incredible. We're here to support the community. Nothing would be possible without the partnerships, with Ken and Amy, and so incredibly thankful for that, and looking forward to our continuing partnerships moving forward. And just to echo, some of Amy's statements, need to be thinking about health and wellness in general moving forward, and the importance of mental health and well-being. And so we're here. We know this has impacted so many people. We know it's going to impact people, moving forward as well. So we're here. The health department's here for you, and just want to thank my staff and volunteers for all their work, and thank you, Mayor, for your leadership in getting us through this.
Thank you, Deanna. Josh, you have anything you'd like to add?
Yeah, just really quickly, just again, just to lift up the partnerships. It's taken all of us to get through this. Like the mayor said, we're building the plane as we're trying to fly it with no manual. It's been a long 13 months. March 2020, the pandemic hit us like an 18-wheeler. And we've asked people to be patient. We've asked people to sacrifice. There is light at the end of the tunnel. We're getting there. We're emerging from this pandemic. The vaccines have been a miracle to battle this pandemic. But we have to be a little bit more patient, a little bit longer. The variants are here. We're still seeing cases. Unfortunately, we're still seeing people get sick and people die. So again, I just want to thank the mayor and everyone on this panel tonight, and all the residents of Norwalk who have sacrificed. They've stayed home. They've kept their distance. And I know everyone's just eager to get out. And we have spring and Memorial Day and 4th of July, and really want to catch up on those missed birthdays and missed opportunities. But a little bit longer. Get vaccinated, and again, watch your distance, wear your mask, and wash your hands. So, Mayor, thank you so much, and back over to you.
Thank you, Josh. And again, thank you to the panel. The information that we discussed tonight, I think, is so critically important. I guess if I had a message, I would say, we know that there are people who are still on the fence. They're not sure if they want to get the vaccine or they don't. And I would encourage everyone who may be in that situation to get as much information as you can, to understand that the science behind the vaccine has been worked on for quite some time, not just the past 6 months or so. I believe it's been worked on for about 9 years. And now because of the virus, they had to accelerate the science in order to create the vaccine. So it's not only about me or you, it's about other people in our families, elderly parents, elderly grandparents, family members who, if you get the vaccine, you're going a long way to protect them as well. So we're here to help you in any way that we possibly can. So if you need information, please reach out to Ken, Amy, Deanna, our local health organizations, your primary care physician, whomever. But try to reach out, get the information, and then try to make an informed decision. Again, it's all about everybody involved. And I know I'm going to throw this out there too, because Amy touched on it. One of our council people is a staunch advocate for proper nutrition and exercise, and the kinds of things that we can do to keep our bodies healthy go a long way to help the vaccine protect us, but also to keep us healthy for other situations. So eat properly, exercise, drink a lot of water, and do the things we know that work, including the masks, social distancing, and washing your hands. And again, thank you, Norwalk, for being responsible and for working with us. Thank you to this panel. We are going to be continuing our panel discussions as things start to develop that we want to talk about. But again, thank you to the panel. Thank you for those people who visited us tonight and asked questions. And thank you for the people who may be watching on YouTube. And thank you to the people that will be watching this after it's over. Again, thank you, everybody.